So this week we're going to look at the last bit of the UCAT that you need to be ready for, which is the situational judgment section. And as I think I mentioned briefly last week, this is kind of very different from the other ones because it's not really about problem solving. It's about deciding what's an appropriate way to behave in different kinds of situations. And so sort of way you need to approach it, the way you need to prepare for it is a little bit different, and indeed the way it's used in selecting for interview is also a little bit different. So we'll sort of talk through those principles first of all, and then we'll look at some questions. So the idea is then that they give you some kind of situation. Most commonly, you have to picture yourself as a medical student and or a dental student, and they put in a mixture of medical and dental questions. And you then have to think about the situation that they place that student in and think about what's an appropriate way to respond to that situation. And they basically give you two types of questions. So the first one is that they will just give you a suggested response to the situation, which might be something you might say or something you might do, and then you have to decide how appropriate that is. Or sometimes they make you kind of take a step back from actually deciding what's the appropriate thing to do and say, well, what are the things you should be thinking about in reaching your decision about what to do? And again, they give you a thing that you might want to think about, and you have to decide how important is that as an issue in deciding what you want to have to do. So that's what the questions are going to be like. And it's important because, as I say, it's the UCAT, but also actually questions like this form a significant chunk of the interview that you'll hopefully get as a result of doing all right in the UCAT. So when you go along for interview, what they're interested in is not how good you are at science, not how much you know about medicine, or not primarily anyway. What they're interested in is your ability to work with people, meaning both your patients and your colleagues. And the way they assess that is largely through things like situational judgment. So preparing for this is actually time well spent, not just because it's a significant chunk of the UCAT, but because preparing for interview is incredibly important. Even if you get over the UCAT hurdle and your GCSEs are all fine and all that kind of stuff, you still only have a sort of 40 to 50% chance of getting an offer, usually. And so again, you've got to be really well prepared to put yourself over in the best possible way in your interview. So we'll talk therefore more about some of these issues when we talk about interview preparation a bit later on. So because it's a very different kind of question, it's not just solving a problem and choosing which of the answers is right. They score it in a very different sort of way. So they will privately decide whether your answer is right or wrong according to does it agree with what they think kind of thing. But they won't actually give you a numerical score based on that. They'll just tell you which of these bands your score comes in. So band 1 means basically that you agree with them most of the time, and band 4 means that you disagree with them most of the time. Obviously, you want to aim for band 1. So that means that because it's not a straightforward numerical score, that the way the universities use it is kind of a bit different as well. So some universities just ignore the situational judgment completely because they take the view that they're going to turn you into the kind of person who has the right sort of moral compass to do the clinical role, and they don't think it's appropriate to expect you to have that at this point. There are not very many of those, though, but it's useful to know there are some. So if the worst happens and you get band 4, then you've got a few universities that are still realistic targets. But the overwhelming majority of um, medical schools, and as usual, the dental schools are much less transparent about what they do. But my suspicion is that the same applies here, that if you get band 4, you get automatically rejected. So no matter how good your numerical score on the cognitive tests is, if you get band 4, most universities will say, no, we're not going to look any further at your application. So that's the primary target here, is just to avoid band 4 at all costs. Beyond that, I mean, it does vary from place to place. Some of them, so long as you avoid band 4, they don't think about it any further. Some of them, though, will give you a score based on what band you've got. And so it's worth aiming for band 1. But as we'll see, it's doing that in some ways is not as straightforward as it is for the other tests. So avoiding band 4 is the primary sort of target. So the important thing is that these questions are what they'll tell you in their own guide to this is, oh, don't worry about it. You don't really need to prepare for this. Just tell us what you actually think in response to each scenario. And that's what we're interested in. But that's actually a disastrous strategy, because what they really want is for you to think, what would an ideal perfect medical student or dental student do in this situation? Not what would I actually do. And of course, it might be that you would be the perfect student, in which case those answers would be the same. But a lot of the time, once we've looked at some examples, you'll see that it's actually really quite hard to be the perfect model student. But it's not so difficult to imagine yourself being it. Okay? And that's what you've got to do. So you've got to figure out what their profile is of the perfect medical student who just knows what all the key sort of ethical principles are and adheres rigorously to them. And then you just put yourself in that role and then think, right, now how would I answer the question? So therefore you need to know a little bit about medical ethics and about sort of professional practice, what the core standards are that are expected for a clinical professional. So we'll talk a bit more about these when we look at interview practice, but we'll just talk about them briefly today. So medical ethics, and these apply to both medicine and dentistry, are usually sort of summarized by what they call the 4 pillars of ethics. And the important thing about this is not these big words. You can use these big words if they help you remember what the things are that they represent. But the important thing is the principles that underscore them, not the words themselves. So autonomy means that basically the patient decides ultimately what treatment they're going to have. You don't, as a clinician. You tell them what you think would be the best thing to do, but they have to give you their consent before you can actually do it. And that's nearly always true. The only time it wouldn't be true is obviously in an emergency situation, if they were unconscious or something, and then you just have to act really quickly. But otherwise, if they haven't consented to whatever process you propose to carry out, whatever drug you propose to give them or anything like that, if they don't consent, you can't do it. And that's really important. That doesn't mean you have to do what they want either. If they say, I want this drug, you can say, no, I'm not going to prescribe that for you. I'm prepared to prescribe this one, but if you don't like that, you'll have to go and see another doctor or another dentist. It doesn't mean that the patient tells you what to do, but it means that they have to agree with what you recommend. Right, the next two, beneficence and non-maleficence, are sort of two sides of the same coin. Beneficence means that everything you do should be with the intention of benefiting the patient. In other words, of doing something that will help make them better. And non-maleficence means that everything you do should be selected so that it won't harm the patient and make them worse. That seems kind of obvious that that's what you would do, but actually sometimes it's not as straightforward as that. So for example, then you think of a situation where it would be actually difficult to rigorously meet both of those criteria at the same time. In other words, being certain that you're going to help the patient, but also being certain that you're not harming them. What sort of situation would that apply? Would it be difficult to rigorously meet that standard? Okay, well, think about every time you prescribe any drug, what's the problem? Oh, I mean, drugs have side effects. So if you prescribe a drug because you hope it's going to make someone better, you've always got to have it in the back of your mind. Okay, there are side effects which could be quite serious, and so you might actually end up doing the patient harm, and it might not make them better because people are different. Drugs don't work for everyone. So in cancer chemotherapy, for example, the drugs that are used in chemotherapy are brutal because they basically damage the DNA in cells and therefore make it impossible for those cells to divide. And to an extent, it's difficult to target those drugs just to the cancer cells that you want to stop dividing. They're going to target normal cells as well, and therefore they have horrendous side effects, which is why, for example, people on chemotherapy, their hair falls out because the cells in the hair follicle can't keep dividing, and therefore they can't renew the hair, and so it just dies off. And that's not a good side effect, but it's not life threatening. But they can, side effects of chemotherapy can themselves become life threatening. So those principles seem obvious. Yes, of course, you're going to only do things for the benefit of the patients and you're not going to try to hurt them. But sometimes there's a balance involved in that, which is actually quite difficult. And the last one is justice, which is sort of the vaguest of these things. That means things like you have to treat all your patients equally. You don't decide, this person is more important or more deserving of treatment than that person. Everyone has the same right to your time and attention. And it also means things like you have to think about the wider effects on society of decisions you make. Like, if you decide to prescribe lots of expensive drugs to all of your patients, then that may be good for those patients. But if it's bankrupting the NHS, then that may not be a good thing. So again, taking that wider view of things. So those tend to be sort of well, autonomy comes up quite a lot actually in the UCAT situational judgment. The others possibly not so much, but it's important to have them in the back of your mind. But say once you get to interview, they're going to be a big deal. The other thing that's really important is this document. The dentists have a very similar but different one, which I'll just show you in a minute. And I will send you the links to all of these so that you can download them and read them. So for doctors, in fact, everybody working in medicine, the General Medical Council produces this document called Good Medical Practice. And it's basically a set of standards for how you're meant to behave. And it's really useful in preparing for this situational judgment thing because you can basically apply these standards and quite often spot what's appropriate and what isn't appropriate behavior. So you're going to need to download it and you're going to need to have read it and thought about it certainly before your interview, but really I think before you do the situational judgment as well. It's quite long, but actually it's very, that's because it gives lots of really fairly obvious examples. So the main thing is just to know what they think are the important things, and then you can just kind of skim through the examples, and mostly you'll think, oh yeah, that's kind of obvious. So it's not as intimidatingly long as it seems when you first download it, but it is important. So it's divided into these 4 sections, which they're called domains. So let's just look quickly at these, because what you're going to find is that all of these are things that you need to be aware of when you're doing the situational judgment question. The first one is knowledge, skills, and development. So they set huge store on the idea that if you're going to be a clinician, it's up to you to take responsibility for making sure that your knowledge of what's involved in doing that is as good as it can possibly be. That your sort of practical expertise is good, so that you've practiced and practiced and practiced to make sure that you can do, carry out techniques as safely and reliably as possible. And it's important for you to maintain that all the way through your career, not just when you're training at the beginning. So that's a big deal, and it comes up a lot in the situational judgment questions, because there are a lot of questions which involve things like, would it be appropriate to miss a lecture or miss a practical because of this thing that you could be doing instead? And the answer is nearly always no, as far as they're concerned. I mean, obviously, there are going to be exceptions to that. It's not that you can, never miss a lecture, even if you're sort of missing your wedding or something for that. There are exceptions, but essentially, they really set a great deal of store by people taking every opportunity they can to make sure that they're as prepared as possible in terms of knowledge and skills. So that's an important thing to know. And actually, just on that point, I was told that of all the people that signed up to do the medicine masterclasses, hardly anybody turned up this week, which was really kind of disappointing and embarrassing for the doctors that had given their time to turn up and do it, and also embarrassing for us. But we're not going to hold an inquisition into who didn't turn up and why, but just to let you know that we were really kind of annoyed about that, and to let you know that if you do that in medical school, you're going to be in serious trouble. If you're meant to be somewhere, if you've signed up to be somewhere and you just don't bother turning up, they're not just going to shrug their shoulders. They're going to, have you in front of them in their office, and you're going to be in big trouble. So, I don't know if that was any of you, but if it was, then take that as a lesson that is not going to be ignored in the future. Okay, so second one, patients come first. That comes up all the time. So when you've got pressing demands, your family need things, your friends need things, your colleagues need things, they have to be put on hold if there are patient needs that need to be addressed. And just being aware that that's, again, in some ways it's obvious, but knowing how important it is, so that you have to prioritize it over things that you might normally think would be priorities, is important as you address these questions. So that includes not just performing the right clinical things, but treating them with respect, with kindness, making sure that what you do is safe, all that kind of stuff. So there's nothing strange and surprising about it, but it's just knowing how important it is. Third one is that they are absolutely obsessed with making sure that you understand that as a clinician, you're part of a team, that you're not sort of independently, heroically saving people's lives, that you can only do that by working effectively with your colleagues. And so there's a lot of emphasis on sort of positive team working skills and things like that. And again, that comes into these questions where you have to show that you prioritize supporting your colleagues, which, if you're a medical student, might mean fellow students, for example, in these questions. And then trust and professionalism, in some ways, stems from the first 3, that patients are only going to trust you if they can see that you're prioritizing their needs, if they can have confidence in knowledge and that kind of stuff. But it's also about the fact that you're supposed to um, behave in a professional way, not just when you're in the clinic, but basically everywhere when you're out in the world. So, it's not appropriate to, go out and get drunk and smash up the bar or something and say, oh yeah, but that doesn't affect my medical practice because I would never be drunk in a clinic. You can't do that. Basically, if you behave like that in any situation, then that's going to reflect badly on you as an individual doctor. But people are, much more general than that, and they're going to say, well, I don't think doctors are trustworthy people because I see them out in the town smashing up bars and things. Okay, so it's about the fact that you're supposed to behave professionally everywhere, not just in a clinical context. So, summary of the same kind of things here, but these are the sort of things that, having read good medical practice, you can sort of look for in the situational judgment questions and think, right, is this question really about prioritizing patients over other people? And if it seems to be about that, then yes, you should always. Is it about making sure you make full use of your educational opportunities? And if it seems to be, then yes, you have to prioritize that kind of stuff. Okay, so a bit of preparation along that is going to really help you do well at these things. Because as you'll see in a minute when we look at some examples, they're not actually very easy, these questions. This is the dentist's version of the same thing. And as I say, I'll send you the links to these so you can see they have 9 domains rather than 4, but they just cover all the same kind of things basically, but just divide them up differently. So they'll use the language slightly differently because it's about dentistry rather than medicine. So if you are proposing to do dentistry, then have a look at this one rather than the GMC one. But essentially, you'll come away with the same messages. Covered all of that. That these are the kind of things that the questions are going to be focusing on. So let's now look at some examples. The first type of question, there are basically 2 types. This one, they just give you a short scenario, but you have to read it really carefully to make sure that you understand the role of all of the individual people in the scenario. And then they'll ask you to put yourself in the shoes of one of those people. And that's why you've got to make sure you know who that person is, what their status is. Are they a student? Are they a doctor? What are they? And then it just suggests a possible way to respond to the situation, and you have to decide whether that's a really appropriate thing to do. First, always the first option. The second one says, well, it's kind of appropriate, but you could do better. So sometimes it can be difficult to distinguish those, and that's why this is hard. And it's why they don't mark it in a straightforward numerical way, because the difference between very appropriate and appropriate but not ideal can be quite subtle sometimes. Inappropriate but not awful means basically that it's just not effective. So it's not doing anything bad, but it's not really achieving anything useful either. That's usually what it means. Very inappropriate means that it will actually make the situation potentially worse, or is just a professionally inappropriate thing for you to do. So that's what you have to decide for each one. So all the time, remember, it's not really, even though they tell you it, you're just supposed to say, what would you do in this situation? What you're really doing is saying, what do you think you should do if you're this idealized person that have exactly the same moral compass as what they've set out in their standards and good practice guidelines. And the other thing to be careful of, as it says at the bottom there, is that just having good intentions, just kind of having your heart in the right place, doesn't make something an appropriate action. It's the effect it will have is what you should be thinking about, not whether your motivation is good. that's really important. Okay, so here's an example. So just read the scenario quite carefully so you understand what everyone's role is. And then there's one suggested response down there, and you've got to choose which one. There are going to be 5 of these on the same scenario. Okay, so you're going to get 5 questions on the same scenario, so it's worth spending a little bit of time making sure that you haven't missed anything in the scenario, and particularly making sure you know who's who. So Aoife is the person who's been upset because she couldn't answer the doctor's questions. Olivia is the person to whom she talks about the fact that she's upset, and you're putting yourself in Olivia's shoes. So with that in mind, what do we think about the appropriateness of that response? Just somebody tell me what you think. This is very different from the other one. You know, in all the sessions we've had so far, you know, I've felt confident that I know what the answer is, not just because I've got it in front of me, but because, you know, I know how to work these things out. But with this, I get these wrong all the time because, you know, it's a matter of judgment, and, you know, moral compass may not always be pointing in the right direction. I don't know, but so don't be frightened to speak up. And if you get them wrong, well, so do I. So what do we think? Come on, you've got to think. Yeah. Okay, so why is it appropriate, but why is it not ideal? Okay, yeah, so that's kind of interesting, which is because I mean you've come up with the same answer in terms of it being B that they come up with, which is good, but the justification is subtly different in that you said she's, you know, being supportive, making her friend feel better, but I mean I suppose and the trouble is it depends how you know how it was said and how you read it, but if you think about it, you know, if you'd done badly in a test and your friend just said, well, perhaps you should have revised, you probably wouldn't feel supported. You'd probably feel kind of annoyed, wouldn't you? You'd think, well, I wanted them to say something. So in some ways, it's kind of entirely practical and not overtly supportive, or at least that's the way they saw it. So, but I mean, you see, it's exactly that you read the same thing, and that's the trouble with this. That's why I think this section is sort of fatally flawed in some ways because it does depend how you read things. So they thought it was B for that reason because they thought that yes, it was giving practical advice, but it wasn't being supported. Whereas your problem was more with whether the advice was the best. And I take your point that you know, advising someone just to focus on the topics that you couldn't answer questions on then is probably kind of missing the point. That they probably should be fundamentally thinking about the way they should learn things. So this is what they said. So the important thing is these questions all come from the UCAT practice website. And what they always do is there's a button that says explain the answer, and that's where these responses come from that I've put on here. So these are not my interpretations of what you should have said. These are their interpretations. And that's what's most important in your practice. Okay, so you're going to have to do hundreds of these questions, but the most important thing is not whether you put A and it should have been B or whatever. It's looking at why, because as you see more and more of these explanations, you'll just get much better at spotting. Oh, they've put this question in to see if I've got the point about autonomy or whatever. And you'll learn what they think are the important things. If you just ignore the reasons and just say, "Oh, I got that one right," I don't really, and you're happy. Even when you get them right, you should read it, because as we saw there, you can get them right, but not necessarily for the same reasons that they did. And it really takes quite a lot of effort, but it is worth it, because you have to avoid band 4, otherwise it's kind of the end of the road for that year, with maybe a small number of exceptions. Okay, so yeah, appropriate but not ideal for whatever reason was their view on that one. So here's another possible response. Okay, so you advise them to talk to the consultant about how about that one. It's important to practice talking about these things, because this is what you're going to have to do in an interview. Okay? That's why it's worth saying what you think now, just to practice putting these things into words. Okay, well, nobody wants to speak then. Let's just do the polls. How many people think A? B? C? D? Okay, so C slightly had the majority there. So why inappropriate then? Or if you proceed, tell me why you thought it was inappropriate. Yeah, I mean, again, it depends how you read it, but yeah, you could read it that way. That it almost seems like you're sort of saying, "Oh, don't bother me with that. Go and talk to someone else about it." And it could be taken that way, I suppose. But equally, they're not just saying, go and talk to some random person. They're sort of saying, go and talk to the consultant themselves. So you can see how that would be sort of sensible. And again, that is a flaw with this thing, that you kind of need to hear them say it really to know whether it's supportive or not. And of course, you don't get that. So yeah, if you read it that way, that would be a potential thing. But if we suppose that they are trying to be constructive and saying, well, if your problem is with this consultant, the best person you can talk to is the consultant themselves, and find out what they think you should be doing differently. I mean, that is kind of sensible advice. Except, what's the problem? I mean, if you put yourself in Aoife's shoes for the moment and think, if this has just happened to you, who's probably the last person you want to go and talk to about it? I mean, the consultant, right? Because if he's just had a go at you, the last thing you want to do is go and repeat the thing and possibly dig yourself into a deeper hole by making them think you're wasting their time or whatever. So I think that's the issue, that you've got to be sensitive to the fact that yes, it's in some ways it makes sense, because you need to know what they really think, or Aoife needs to know what they really think. But it's not really very supportive, because you can sense that that's not really something they're going to want to do. So I suspect it's going to be a B, that one. That reason there. Okay, so yeah, the problem is that you want to have someone who can give you sensible advice, but where it's not going to be stressful and already had a stressful experience. So then they come up with this alternative. that one. Better or worse? Initial again. Yeah, A is the right answer for that one, which is interesting because you, again, I can't tell you really, you might have the same response as you had before, that you just seem to be saying, oh, I don't want to talk about it, go and talk to someone else about it. But there's a really important message here, which is that all the way through your career as a student, as a trainee, doctor or dentist, right up to the point, where you're a consultant, basically, you're going to have a supervisor or a mentor or, somebody whose job is basically to be the person that you can go and talk to about problems. And the system is supposed to be that that person will, be wise and knowledgeable and experienced and a good listener and be able to give you really helpful advice. And of course, you know what the real world's like, that, it's like personal tutors. Some are much more helpful than others and things like that. And the same is going to be true all the way through your career. So in a realistic situation, it would depend on who the supervisor was. But remember, this is an ideal world we're talking about here. And so in this, all supervisors, all mentors do what they're meant to do and know the system, know about student problems, are empathetic to those problems. And so whenever you get that as an option, that's going to be a good one. Okay, so that's just what's important to know, because that may not be obvious based on your own experience, but knowing that that's what they think is going to be really helpful going forward. So that's why doing this practice, and that was the way they expressed that an educational supervisor's role, blah, 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 and they tell you what educational supervisors are meant to do, and they don't worry about the fact that some of them aren't very good at it. Now know going forward that anytime there's a problem, that's going to be a good thing to do, is to go and talk to them. So you can see that the best thing to do once you start doing this in earnest is to, as you go through your answers, to just kind of make some notes on key principles, like supervisor, good person to talk to, and red box around it or something, so that you know that. What about that one? So again, you've got these two issues really, that you want to be supportive, but you want to give, constructive, helpful advice. So what does this fail to do? Well, I mean, it doesn't give any advice at all, does it? It just says, oh, don't worry about it. It was, they're just being unfair. And again, you can probably picture yourself saying that, because you want to make the person feel better, and the easiest way to do that is to say, "Oh, don't worry about it. It's just them. They're awkward people. Don't bother about it." But that's not appropriate, because there could be a problem there. You can't take it upon yourself to say um, those questions were unreasonably difficult, because you're just a fellow medical student. You're not somebody who's in a position to make that judgment. And you really need to be encouraging Aoife to at least accept that there may be a problem here, and that she ought to find out what's the best thing to do, which is where the supervisor would come in. So I think that's going to be inappropriate, because it's not doing anything helpful, but it's worse than that. But because by making her think, oh, there isn't a problem, she might be then failing to address something that really is a problem, potentially doing harm. So I think that's going to be a C, possibly even a D, but because it's supportive, it's probably a C. Okay. And then yeah, it's a little bit presumptuous, isn't it? So I mean, it's supportive, and it that I mean that ought to be true if Dr. Webster is a reasonable person. As we all know, consultants are not always reasonable people. Um, so yeah, I mean, I agree with that. I mean, my feeling was that that was probably a B because it was a sensible thing to say that any reasonable person wouldn't make a judgment just based on a single interaction like that, and it's supportive. But as you say, it's making assumptions about that consultant, and it's also not giving any actual advice other than don't worry about it. And so I didn't think that qualified as an A, but they did, which just makes the point, that these are grey areas. So I give, it suggests correctly that Dr. Webster will not make a judgment, but as you say, without knowing Dr. Webster, how do they know that? And you are going to find this, at least if you're like me, you're going to find this incredibly annoying because you're going to get quite a lot of them a bit wrong, or at least where you just, even having seen the explanation, you disagree with them, and you just can't avoid that. So to an extent, you can learn to think like they do, but even then, you're going to find that they're a bit inconsistent and that you don't always agree with them. But what's really important to know is that they don't just kind of mark your response right or wrong. So in this case, it wouldn't be either you got A or it's wrong. If you got something that is quite close to it, so B, I guess in this case, you would get maybe like 1 mark instead of 2. Whereas if you got B, you would get no marks. So there is a sort of sliding scale thing. And to avoid band 4, you just need to make sure you're not at the other end of the spectrum all the time. And that's the reassuring thing, because otherwise you can start to panic after a while. And I think, it, nearly always it's a bit of a toss up between two of them. And it never seems very clear, or not never, but often doesn't seem very clear which one it is. So it's going to be really tough. But actually, that doesn't really matter all that much. So long as you're in the right general area, you're going to get enough points to avoid band 4, which is what your target is. But yeah, I mean, it is very different than the other questions where you look at the explanations and they tell you exactly what you should have done, so you can clearly learn from them. From these, they give you their point of view, and sometimes you're going to think, well, that's just not right, but you can at least learn how they think, and that will really help you going forward. Okay, so I think that's it for that scenario. So let's have a look at the next one. So this is a different style of question. This time, again, they'll give you a scenario. Again, you've got to read it carefully, make sure you know what everyone's role is. But then they're going to ask you to take a step back from actually making a decision about what you should do and just say, well, what should you be weighing up? What are the important issues to think about in relation to then deciding what you would do about it? And that's important again with the interview in mind. Because if they ask you one of these kind of situational judgment questions in an interview and you just say, well, this is what I would do, it will look to them as if you're not the kind of person who considers things very carefully and you just, you know, make a snap decision about what you're going to do. Whereas what you've got to convince them is that you'd weigh up all the factors and reach a balanced view of what's the best thing to do. So this will kind of hopefully help you in preparing for the this is my rationale part of your answers. Okay, so let's have a look. We can read that and then see what you think. So again, make sure you know what everybody's role is. So Kim, who's the offender here, um, is not a medical student, but is your friend. And that's what you've got to remember when you're putting yourself in Vinny's shoes as to what should he do about having observed Kim's transgression. So is it a big deal that Kim will be in a lot of trouble if he reports her? That's something that is very important in deciding how you should act, or is it not important? So shakes her head. Does that mean not important at all? What were you thinking? Yeah, maybe agree with that. So remember, I mean, I think most of us in that situation, if it was your friend, it would be quite difficult to ignore the fact that they're your friend, really, wouldn't it? And you're going to think, is there a way out of this that means I don't have to report my friend because that's, not something really not something I want to do. So that's why it's important to remember that this is not about how you would actually feel in this situation. It's about what you should do if you're this kind of idealized person that they come up with. And the idealized person would say medical school rules are more important than friendship. Okay, so they would say that would be that if there's a rule that says nobody who isn't a medical student should be in the room and there's nobody at all should be taking photographs, and Kim's transgressing on both of those points, then those rules are there for a good reason, and therefore it's incredibly important that everybody obeys them. So forget everything else. That's you have to forget the friendship. You have to forget the fact that you're dumping your friend in a lot of trouble. Um, that's not important at all. Okay, so that's the way these things work. And when it brings in friendship and things like that, that's when you have to work hardest, I think, at not thinking how would I feel in this situation, but what should I do, at least in the world that the people setting the questions live in. Okay, so let's look at some more of those. So think about that one. So is it a good thing to sort of say, well, it's going to be a bit awkward for me to intervene, even though I know I should, but somebody else might, and that takes the pressure off? No, I mean, you're going to feel that, but you think, oh, it'd make my life so much easier if somebody else does it, but that's inappropriate. So that's again, it's that's not important at all. You, what's important is that you do the right thing. So that's a D again for the same reason. So that one feels like a D again. I think for a subtly different reason, in the sense that it's obvious that Kim does know that she's not supposed to be there because she's had to borrow somebody else's ID badge to get in. So she obviously knows she's not meant to be there, and therefore you don't waste any time wondering about whether she knows she's not meant to be there or not. So it's not important. So it's been D, D, D all in a row here, and it's important to know that they will do that sometimes. So you can't kind of play games and say, oh, we've had a couple of Ds, so it's going to be something different this time. They don't do that. They will deliberately try and trip you up sometimes. So that's another D for the same reason. Sorry, for a subtly different reason, I think. We already covered that. So D again. Yeah. But medical school rules, medical ethics, all of that is more important than personal relationships. That's the general point you've got to take. So that's going to be D again. And that's the end of that one. So that was kind of instructive because you can see that they can just keep hammering on about um, all the kind of things that in real life would make it difficult for you to act, but you've just got to be resolute and say, no, the rules come first. And so long as you do that, then you get pretty much the right answers. Okay, so try this one. Okay, so again, you've got to make sure that you clear up the roles of the people. So you've got the doctor, but you're not really being asked about the appropriateness of the doctor's actions. So what you feel about that's kind of irrelevant to this. And then you've got Loki, who you probably thought was a Norse god, but is now apparently a medical student. And that's important that they're a medical student, not a fellow doctor, not a qualified professional, and that's going to be important. And then you've got the patient as well. So medical student says, I will follow up with the doctor about what the next steps are for a formal diagnosis. I think there are good and not good points about that. So what's the good thing about it? Yeah, I mean, the patient is obviously upset that, you know, the doctor is implying they don't really know what the cause is, and he's guessed that it might be IBS, but he doesn't really know, and they're left thinking, I don't really know where I stand here. So Loki is trying to be supportive and sort of say, well, okay, I'm going to see what I can do to, to find out what happens next to make sure that we do address your problem. So that seems like a good thing, but what's not good? So as a medical student, to what extent should you be making decisions about what's done in terms of medical practice? Yeah, not at all. That's the other important thing to be aware of. That until you qualify, all you ever do is observe. You're not considered to be competent to make any kind of decisions. And the thing is that by telling the patient you're going to do this, I mean, you're only saying I'm going to go and find out, but you are making a decision, which is that there are a formal you know, that there is going to be a procedure leading to a formal diagnosis, and you're going to find out what it is. Whereas the doctor may have decided that they're not doing any more at this point, and he obviously hasn't handled it very well, just leaving that unclear to the patient. But it's not really up to a medical student to take it upon themselves to say, well, I'll get it sorted out. So I thought that was probably going to be C for that reason, but they said B. So, but when you read the rationale for it, it mostly seems to be saying, that they're not competent to be making this kind of intervention, so they shouldn't be doing it. It is important that trainee doctors understand their roles and only practice within their allocated ones. And since it goes on about that for about 6 lines, I thought that was going to say it's inappropriate. But they said, well, that means it's not ideal, but it is appropriate because it's supportive and reassures the patient. I don't really agree with that, but as I say, that's what you're going to feel a lot of the time. But so long as you thought about those 2 issues, you were probably going to go for B or C, and so again, you wouldn't be too far away, and that's the important thing. Okay, so try the next one. That's probably one of the more straightforward ones. Yeah, and I think that's a very clear D for that one. You should be happy that it's just IBS. I mean, it's not your place to tell the patient whether they should be happy or not, but it's also very inappropriate to sort of make light of what can be a very unpleasant condition for people like that. So yeah, that's totally inappropriate, I would have thought. And that's what they're saying here. Yeah. Okay. So what do you think about that? Good thing to say. Yeah, because what are you demonstrating? That they're always very keen you should demonstrate. E word, which is going to come up all the time when you're talking about occupation. Empathy. Yeah. So whenever you get something which appears to be a demonstration of empathy, which means sort of persuading the patient that you really do understand how they feel and that you are on the same page as them and you want to that's helping guide you in how you go forward with things. That's what empathy is all about. And in some ways, that's not really, that's almost not really showing empathy, but it's saying that you're empathetic, which is not quite as good as actually showing it. But that's, I think, going to be considered very appropriate. Again, I wondered about whether it should be B because, I mean, it says that, but then it doesn't make any positive suggestion as to what you can do about it. But he's not really in a position where he can do very much about it. So I think perhaps for that reason that they thought A was the right one. But yeah, if you spot empathy, that's always going to be an appropriate thing. That's again an important lesson there. And then this one. So if you remember a couple of questions ago, we had I'll ask Dr. Nicholas what the next steps are going to be in reaching a formal diagnosis. And I thought, well, this is saying more or less the same thing. So therefore, the response would be the same thing, which, if you remember, was B in that case. But so I can't really, and the rationale is basically the same. They just came to a different conclusion. So I genuinely mystified as to why that's C, whereas I'll find out what the next steps are and reaching a formal diagnosis was B. But nobody tell me because I don't know. I mean, all I can think is that I suppose it's being a bit more specific and kind of implying that um, the doctor should be thinking about doing more tests, whereas the doctor may already have ruled that out. Incredibly potentially, yeah. So I suppose the the taking too much upon yourself when you're just a student is more of an issue here, and kind of implying that yeah, that perhaps there are more tests that can be done. It's quite a subtle thing. So, you're going to have to accept that there are going to be ones like this where you're going to get it wrong. But so long as you're not too far away, it's the ones where you think it's an A and they think it's a D. That's where you have to sort of worry. But if you're there or thereabouts, then it's not too big a problem. Okay. And then this one. Then I think it's quite difficult, but anybody want to suggest what they think is the right answer? In the end, this is the game you're going to have to play, but you're going to sit there thinking, well, I'm not really sure, but I'm going to think I'm going to go for this one for whatever slightly tenuous reason. So, what do you think? Any votes for A, B, C, D? Okay, so you're getting good at this because I think C was the right. Oh no, B was the right answer for that one. But again, you can see it's saying more or less the same thing, right? Operating outside the scope of his practice as a medical student. Um, and I just always feel that should mean it's inappropriate, but they seem to think that because it's reassuring the patient. Um, and I also thought that in some ways this was worse than the earlier ones because it's actually sort of saying, well, just go away and don't worry about it, and that really is kind of giving medical advice when you're not in a position to do it. So I thought that was a definite C, but it just goes to show. So be prepared to be frustrated and annoyed, but doing like we've done this morning is going to be incredibly important nearer the time. But I would do that reading up on the um, medical ethics and the professional standards and things like that first, because quite a lot of the issues that come up are covered in those, and it will just help you. It will give you a prompt to think, oh, that's what the issue is that they're exploring here. Sometimes because it doesn't, because a lot of medical schools just look at the numerical scores for the other ones, and they don't set a lot of store by this one. People um, spend a lot less time on this one, but I think that's probably a mistake, as I say, for two reasons. One is that if you get band 4, it's catastrophic, and the other is that by preparing for this, you're preparing for the interview, and in the end, that's the thing that's going to really make the difference. Okay, so that's all we're going to do on UCAT for the moment. But we'll talk about some other things like how to choose which medical schools to apply to and how to prepare for interview and things that you should know about the NHS. So those are the kind of things we'll cover in the next few weeks. Okay, but we'll leave it there for